Good morning, everyone, and welcome. Before we begin, I would like to acknowledge that we are gathered on the traditional and ceded territory of the Algonquin and Anishinaabe people. My name is Maggie Chi. I'm the Parliamentary Secretary to the Minister of Health, Marjorie Michelle. Joining me today is the Honorable Eleanor Olszewski, Minister of Emergency Management and Community Resilience and Minister responsible for Prairie Economics Development of Canada. Also joining me today is Conrad Sauvé, President and CEO of Canadian Red Cross, and my colleague, Parliamentary Secretary Anthony Housefather. Please know that there will be an opportunity for media to ask questions following the announcement. Please, a big thanks to the Canadian Red Cross for hosting us today and for the role you play in supporting people and communities in times of need. Emergencies can challenge the way people and communities cope, and the mental health impacts can be long-lasting. Today we're here to talk about how we can better support social, emotional, and psychological well-being of people and communities during and after emergencies. It is now my honor to introduce the Honorable Eleanor Olszewski. Minister Olszewski is a distinguished legal professional with a strong commitment to advocacy and fairness in the legal system. She's a civil litigator with extensive experience in commercial litigation, insurance defense, and administrative law, with a focus on professional discipline. She also holds a Bachelor of Science in Pharmacy from the University of Alberta. Please join me in welcoming the Honorable Minister Eleanor Olszewski.
Good morning, everyone. Bonjour tout le monde. I'd like to thank the Canadian Red Cross for joining us today and for the vital support that you provide Canadians when it matters most. Your work is challenging, but it's fundamentally important. So we know that across Canada, communities are facing more frequent, more severe, and more costly emergencies. Wildfires, floods, storms, and other disasters can change lives in an instant. They can force families from their homes, disrupt routines, isolate communities, and leave people facing uncertainty at exactly the moment that they need support the most. So Canada's government is focused on what we can control, being better prepared before emergencies happen, strengthening the systems that people rely on during a crisis, and building more resilient communities for the future. So that work includes the visible parts of an emergency response, so food and water and shelter and clothing, evacuation, medical supplies, but it also includes the needs that are less visible, but really no less urgent. Clear information, helping navigate services, and mental health support for people experiencing stress and loss and anxiety and uncertainty. Because really, when someone's living through an emergency, they need more than just a list of services with some phone numbers. They need support that's practical, that's compassionate, and that's easy to access. There is no substitute for a caring hand, someone who can make sense of what's happening, connect people to the right supports, and then walk alongside them as they begin to recover. So that is why today, on behalf of the Honourable Marjorie Michelle, Minister of Health, I'm really proud to announce that the Government of Canada is providing $1.2 million to 4 organizations to strengthen mental health and psychosocial supports in emergency settings. First, the Canadian Red Cross, who is here with us today, is receiving $650,000 to expand psychological first aid training for as many as 6,000 community-based organizations and service providers. They'll create, amongst other things, a mental health toolkit to help organizations deliver coordinated support during times of emergencies. JOC.org is receiving $250,000 to strengthen mental health training for 1,000 educators and professionals. And these people will work with youth aged 14 to 25, both during and after emergencies. The Canadian Coalition for Seniors Mental Health is receiving $100,000 to help them develop practical and evidence-based resources for healthcare providers and caregivers, and that's to support older people as they work their way through emergencies. And finally, McMaster University is receiving $198,700 to develop new tools that will build on a tool they're already working on, the Canadian Emergency Response Psychosocial Support Network, also known as CanEMERG. So each of these projects is different, but they're all grounded in the same understanding. Emergencies don't affect people in exactly the same way. A younger person displaced from school, an older adult who depends on regular care, someone who's homeless, someone who's already navigating mental health challenges. These individuals will all need different kinds of support, and that is why, it's exactly why these projects matter. Preparedness is about more than what happens when a disaster strikes. It's about the work we do to make sure that people are supported, communities are connected, and systems are ready. By investing in mental health and psychosocial supports, Canada's new government is helping communities respond with care, recover with dignity, and build the resistance they need to meet the challenges ahead. Thank you so much. Merci beaucoup.
And I would like to invite my colleague, PS Anthony Housefather, to the podium.
Thank you very much, Eleanor and Maggie. Bonjour tout le monde. Hi, everybody. Je tiens à remercier le Croix-Rouge canadienne de s'être jointe avec nous aujourd'hui et pour le soutien vital que vous apportez aux Canadiens et Canadiennes quand cela compte le plus. Partout au Canada, les communautés font face à des urgences plus fréquentes, plus graves et plus coûteuses. Les feux de forêt, les inondations et autres catastrophes peuvent transformer des vies en un instant. Ils peuvent forcer les familles à quitter leur foyer, isoler les communautés et laisser les personnes dans l'incertitude au moment où elles ont le plus bien besoin de soutien. Nous nous concentrons sur ce que nous pouvons contrôler, être mieux préparés avant les urgences, renforcer les systèmes sur lesquels les gens comptent lors d'une crise et construire des communautés plus résilientes pour l'avenir. Ce travail inclut les éléments visibles de la réponse d'urgence, nourriture, eau, abri, vêtements et fournitures médicales, mais elle inclut aussi des besoins moins visibles et tout aussi urgents. Information claire, aide à la navigation des services et soutien en santé mentale pour les personnes souffrant de stress, de perte, de peur ou d'incertitude. Il n'y a rien qui remplace une main tendue à quelqu'un qui en a besoin. Quelqu'un qui peut aider à comprendre ce qui se passe et marcher à leur côté alors qu'ils commencent à se rétablir. C'est pourquoi aujourd'hui, au nom de l'admirable Marjorie Michel, ministre de la Santé, on est fiers d'annoncer que le gouvernement du Canada fournit 1,2 million de dollars à 4 organisations pour renforcer les soutiens en santé mentale et psychosociaux en situation d'urgence. La Croix-Rouge canadienne, ici avec nous aujourd'hui, reçoit 650 000 dollars pour élargir la formation aux premiers secours psychologiques à près de jusqu'à 6 000 organisations communautaires et prestataires de services. Ils créeront également une boîte à outils pour la santé mentale afin d'aider les organisations à fournir un soutien coordonné en cas d'urgence. Jack.org reçoit 250 000 pour renforcer la formation en santé mentale de 1000 éducateurs et professionnels travaillant avec les jeunes âgés de 14 à 25 ans pendant et après les urgences. La Coalition canadienne pour la santé mentale des aînés reçoit 100 000 dollars pour développer des ressources pratiques et fondées sur des données probantes destinées aux prestataires de soins de santé et aux aidants qui soutiennent les personnes âgées lors des situations d'urgence. Et l'Université McMaster reçoit 198 700 000 dollars pour développer de nouveaux outils qui s'appuieront sur le réseau canadien de soutien psychosocial d'intervention d'urgence, également connu sur le nom de CanEMERG. Chacun de ces projets est différent, mais ils reposent tous sur la même compréhension. Les urgences n'affectent pas tout le monde de la même manière. Un jeune déplacé de l'école, un adulte âgé qui dépend de soins ou une personne en situation d'itinérance peuvent tout avoir besoin de différents types de soutien. C'est pourquoi ces projets sont importants. En investissant dans les soutiens en santé mentale et psychosociaux, le nouveau gouvernement canadien aide les communautés à répondre avec soin, à se rétablir avec dignité et renforcer la résilience nécessaire face aux défis à venir. Merci beaucoup.
Thank you both to the Minister and Parliamentary Secretary. I will now invite Conrad Sauvé to talk about the impact of this funding on the Canadian Red Cross and how it will be used to expand their support. Under Mr. Sauvé's leadership, the Canadian Red Cross has become a global leader in emergency health and raised public awareness of the vast array of services that the Red Cross provides.
Thank you, Minister Olszewski, Parliamentary Secretary Housefather, and Parliamentary Secretary Chi. Good morning, and thank you for being here today for the launch of this important initiative. Bonjour et merci de votre présence aujourd'hui pour le lancement de cette belle initiative. Today's announcement from the Public Health Agency of Canada is welcome news for us. Having been on the front lines of emergencies, both big and small in scope, there are things that are physically seen and there are others that aren't. What you see in the emergency situation and the initial physical damage of a disaster. What you often don't see are the lasting impacts that people may have as a result. It's one thing to help people rebuild their homes. It's another to support people through those lasting, unseen impacts as they rebuild their lives. Providing mental health and psychosocial support when responding to emergencies is extremely important. The funding announcement today will enable the Canadian Red Cross to deliver the Strengthening Mental Health and Psychosocial Support Preparedness in Emergency program. Through this new program, the Canadian Red Cross will bring together service providers and community organizations from across the country to provide accessible, practical tools, training, and resources that will strengthen mental health resilience before, during, and after emergencies. Le financement annoncé aujourd'hui permettra à la Croix-Rouge canadienne d'offrir le programme de renforcement des services en santé mentale et bien-être en préparation aux situations d'urgence. Grâce à ce nouveau programme, la Croix-Rouge canadienne rassemblera des organisations et prestataires de services autour de l'objectif commun d'offrir de la formation et des ressources pratiques pour renforcer la résilience en matière de santé mentale avant, après, pendant et après les situations d'urgence. My sincere thanks to everyone who has played a role initiating this program and getting us to where we are today. To our partners at the Public Health Agency of Canada, I would like to thank you for your leadership and your commitment to the mental health of Canadians who have been impacted by emergencies. The road to recovery can be long and difficult, but it's not a journey that needs to be taken alone. Thank you. Merci.
Merci d'être venu. Thank you everyone for coming. So at this point, we'll turn the mic over to the media. Donc à ce moment, nous allons tourner le micro pour les médias. Donc pour chaque média, c'est une question et une question de suivi for each media. It's one question plus a follow-up. Thank you. Any question from the media? Thank you for coming. Merci d'être venu.